Hi again. This time I am in my car at work. I think I'm going to keep doing these in different places just to keep you guessing, and to keep the background changing so you don't get bored. But seriously, it basically boils down to when I have the chance to do these. I have the intention of doing them in the morning while Aiden is still asleep, or Vernon hasn't gotten home from work yet, or whatever, but it just seems to not always work out. So this time I'm in my car. This time I was basically just going to talk about my doctor's appointment on Monday the 16th. That's when I go in to sign all of my consent forms and get pre-op instructions, all that stuff. I'm hoping not, but I think that is probably going to hit me hard, because it's really happening at that point, even though I still will have 2.5 weeks at that point before the actual surgery. So I don't know, I'm just going to see how it goes. Like I said, maybe I'll be okay. Well, fingers crossed. But I do have questions that I want to ask him while I'm there. Let me find my paper, because I have to write everything down. If I think of something, if I don't go ahead and write it down 2 seconds later, I have forgotten it. So I am a compulsive, consistent list maker. Post-it note queen, I like to call myself. Basically, I plan to ask him about lymph node dissection. I don't know if they do that with every procedure. I've read it in a few places where they did do it, but because the person had been diagnosed with breast cancer, so as part of that, they took out some of the lymph nodes so they could test them and see, but I've also seen in some places where people haven't had breast cancer diagnosis, but they still took lymph nodes to test them anyway, just to be sure. So, and from what I understand from that, it makes the pain a little bit more intense afterwards, and a little bit longer recovery, a little bit longer before you can use your arms and everything. So I plan to ask him about that and see what the plan is as far as that goes. If there is, I know they'll give me like range of motion exercises to do at home too. Probably not right away, obviously, but after a few days. But I'm wondering if I can do physical therapy. I'm sure it depends on if my insurance will cover it, but I don't know if that's commonly a part of this for some people, or I don't know. But I plan to ask him and see what he says about that. Let's see. The current medications I'm taking. If I can keep taking those up until the surgery, after the surgery, or if I need to stop those. I mean, I know you have to stop taking like aspirin or any type of blood thinner a couple of weeks before, and some vitamins and herbal supplements and things like that. But I don't know if that includes like your regular prescription medication. So I need to ask about that. And this one's kind of a yucky question, but I've seen it repeatedly, and obviously it's going to be part of the whole recovery process. Stool softeners. Because from what I've read, anesthesia can kind of slow things down in that area. So you may tend to get constipated. And I've read where some people, as soon as they get home, they start taking them. But I've also read where some people started taking them a day or so before their surgery. So asking him, what's the best way to do that? And the most important thing, it goes without saying, can I get toe polish on my toes before the surgery? Because I've read, again, in some places where they don't want you to have any polish on your fingernails or your toenails, just so they can kind of check your circulation. But I've also read where other people, as a way to kind of treat themselves and get ready for the surgery, they did have a pedicure. So I would definitely want to have a pedicure, because I do them all the time anyway, and I love them. But I want to know if I can do it and get some, nice funky polish on my toes or something. If not, then I probably will at least do the pedicure still, just not with polish afterwards, which I'm not looking forward to that, but at least I'll get pampered a little bit before. But you know, that's something I definitely want to make sure that I find out about. I've also read in some cases where people, they come out of they get the tissue expanders like I'm getting, and then they come out of surgery and they wake up and what they have in place of where their breasts were are as big as their breasts were. So it's almost like they, there's no difference. They don't notice a difference. And it's because the plastic surgeon sometimes goes ahead and puts the expanders in and fills them to a certain point. And then you still go into the office for follow-up fills until the implant exchange. So I don't know if that's an option for me. I kind of hope it is, because I don't want to come out completely flat-chested. I think that would just, even though I probably won't be able to feel anything up there, I think it's going to be too weird for me. I mean, obviously it's part of it, and duh, I can't get around that. But if I do have the option of getting a little bit of something that somewhat resembles a breast, I definitely want to do that instead, if at all a possibility. But again, I don't know if that's an option for me. Let's see. Oh, also I mentioned in my last video that of all the resources that I've found, I'm going to post the ones that have been the most helpful for me. So those will be down below. I'll try to put as much detail in the links as I can instead of just giving you links. But each one of these has helped me in some way or another in preparing, in making a list, in knowing what to expect, before, during, after. All of it has been very helpful to me, and I don't think I could get through it if I hadn't found this information. But I also think I'm at the point where I'm kind of in information overload. It's basically been it's all I have been doing for the past couple of weeks. It's just looking some more, reading some more, making lists, adding to those lists. And so it's like I'm overwhelming myself. I need to back off of it a little bit and just stick to basic everyday stuff. But then I went to the library the other day and checked out 3 books about the whole thing. The Breast Reconstruction Guidebook, which I've seen over and over and over again as a good resource. A book called Previvors. It's a book about, I think it's 5 women and their story with basically being BRCA positive and then having the prophylactic double mastectomy, and then another book called Now What? A Patient's Guide to Recovery After Mastectomy or something like that. So, again, it's still research and still getting information, but my thing is it's not Google searching all day long and clicking this link and that doesn't work, and that's not what I need, and maybe this is, and so the tediousness of that is just sitting down, relaxing, and reading a book. So I'm going to try to just stick to that. One fun thing, if anything could be fun about all of this, is I found out that my general surgeon, my breast surgeon, the one who would be removing my breasts, was actually my mother's breast surgeon 14 years ago when she had a lumpectomy. And I meant to ask him whenever I went in for the very first visit, because there's not, Mobile, it's a big city, but also as far as specialists and things like that go, there's just not a lot. So, people around here tend to be using the same doctors. And so I meant to ask my mother the doctor's name, and I meant to ask him if he possibly had a patient, by that name, and it just slipped my mind. And then when I was talking with my mother about the other day, she asked me who my general surgeon was, and I told her. She's like, oh, well, he was my general surgeon. So that makes me feel a little bit better, because she, she's fine, had no problems after her surgery. So, and the fact that it was 14 years ago, so obviously he's been practicing for quite a while. Again, that just makes me feel better. But I just thought, small world, as it tends to be in this area. Let's see, was there anything else? I think that was basically it. Like I said, getting ready for my visit on Monday. Preparing lists of questions to ask. Some of them are probably goofy, but you know what? I'm the one getting my boobs removed, so I think I'm entitled to ask as many goofy questions as I would like. So I guess that's all for now. Probably in my next, I think I said this in my last video, but in my next video, I'm probably going to do a little bit of you know, the things I've read, things that I'm probably going to be missing the most after the surgery. For example, like not being able to move my arms, which means I can't cuddle with my 2-year-old, even though that's one of my favorite things to do. I won't be able to pick him up for quite a while because he is well over 5 pounds. So just little things like that. I want to talk a little bit more about that, you know, just in my research and what I found, things that I would never have thought of on my own if I hadn't found out from all these other people who have gone through it. But I hope you found this one helpful too, and you'll never know where I might be next time doing these videos. Like I said, I think I'm going to keep you guessing. I think that's a lot more fun that way. But I guess I'll talk to you guys next time. Check out the links below. They are very helpful. So for now, bye-bye.